some kind of inspiration at certain point of your life, you would have got maybe in your 10th standard or 12th standard, or
Okay.
somebody who you would have seen in your family or neighborhood or friends. That inspiration, how did you get? Who is your
Okay.
inspiration? Because if you want to
Okay.
serve, there are various social activities that you could. Why exclusively that you have chosen this doctor profession? Who is your
Okay.
inspiration? So that is
All
also
right.
very needed point that you have to incorporate.
Okay.
Yeah.
Fine.
Who is your inspiration?
So,
Who is your inspiration, and at what age that you make up that you had made up your mind that I should become a doctor? If I become a doctor, this is how my lifestyle could be. This is how I have to do. So such frame of mind ideologies. At what age? When did you get that spark?
okay. So I had just, I was in my teenage. My mother was a chronic migraine patient, and I was inspired by her neurologist because I had seen her in her worst of her times, and the way that her neurologist helped her through those attacks, and the way she got cured from the disease. I was totally inspired by the profession, and that is when I chose to become a doctor.
Okay. At what age was it?
14 years.
14 years. Well, so if you want to say this particular
My ninth
idea,
time. Yeah.
yeah, you could say that if the question is given to you, if it is thrown at you that, why did you become a doctor? Who was or who is your inspiration? Do you have the job satisfaction in this particular profession? Then you could say
Okay.
that, well, it is quite interesting to answer. First of
Okay.
all, I had this idea to become a doctor because of
Okay.
the sickness and the traumatic experience that
Mm.
my own mother she faced when I was 14 years old. She had a kind of neurological problem, and often she need to take treatment. The neurologist whom she had visited, I got an opportunity to accompany my mother, and the doctor who was treating my mom, he was quite optimistic and given a proper treatment and medication, and had given a lot of counseling with lots of patience and perseverance. That was quite inspiring, and whenever in that tender age when I visited the doctor with my mother, and there was a drastic change in my mom's health condition, and she started to improve and she was fine one fine day. She was all right when one fine day I could say. So there, I know I got the inspiration that I should also become a doctor, and I have to work towards the sick and needy people, and I have to extend my service for the welfare of the sick people, and I have to see the a beautiful smile and happiness after recovery. So that is my inspiration, honestly speaking. And yes, after becoming a doctor, really I have the job satisfaction because I meet a lot of patients who are getting cured, and they just thank, and they just walk out with a smile. That is really a quite inspirational moment to me. And obviously I get a lot of satisfaction because I've chosen the right path which is quite suitable to me. So that way you could
Okay.
bring. See, it is as I told, right? It is more like a little. What would you say that that enthusiasm, optimism, right? And
Yeah.
you have to get make use of every question that has been given to you. Rather, you're answering the question how better you could exhibit your intelligence, your caliber
I
of
got it.
skill. Yeah, how do you strike the uniqueness to get the best of score? That is the ultimate
Okay.
objective, right?
All right.
So yeah,
Yeah.
wonderfully
So
you have
I'll
put.
start and I'll start preparing these with L-Dopa by explaining the importance of the medication and how it will improve the prognosis. Explain what Parkinson's disease is, the degenerative disorder of the CNS, and what happens neurologically, often impairs the motor skills, speech, and other functions. Explain that the cause of Parkinson's may be head trauma or exposure to toxins or simply unknown. Recommend physiotherapy and explain ways in which it can help, like movement, initiating gait, pain, breathing, etc. and answer questions about the benefits of exercise, acupuncture, massage, but emphasize that they are not alternative to the medication.
Well, so as per the task, it's very clearly given what are you supposed to speak. You have to first encourage the patient to go for the L-DOPA and why it has been prescribed, what all the ways, it could help the person to gain the motor skills and the prognosis, how it could, and also, if the patient is reluctant to go for that, if the patient is recommending you to go for acupuncture or exercise and any other treatment rather taking the drugs, you have to insist apart from doing all these things, why this medication is mandatory. You could not skip that. You have to explain, right? And so what is the cause for this Parkinson disease, how traumatic it could be, and if it is untreated, whether it is fatal or life-threatening, and treating on time, what way it could help the patient. If it aggravate to the last stage of the fifth stage, how severe it could be, to avoid all these things. And moreover, this kind of Parkinson disease, it is treatable, but it is uncurable. You could not cure it, but you could treat it on time in order to control it. So these all are very important information that you have to share with the patient, one after another, not randomly altogether. And whatever it is given, just reading from the card, you should not. You have to explain it little elaborately to the patient. Okay. So first of all, once the card has been given, as I told, you can make note in